Hello guys, my name is Della and today we are talking about pneumothorax. So in this presentation we have a couple of objectives that we are going to accomplish. So what are the causes of pneumothorax? Different types of pneumothorax, some tests and diagnostics that we could do to figure out if it's pneumothorax or not. Treatment and management that we could do for patients that is having or is potentially to have pneumothorax, and our role as a respiratory therapist. So what is a pneumothorax? Pneumothorax, or we could also say collapsed lung, is a buildup of air in the space between the lung and the chest wall. So basically, when we breathe in, our lungs gets filled with air. In the case of pneumothorax, the lungs gets punctured or in some sort gets some lesion, and the air escapes from the lungs going into the pleural space. So when we breathe in, instead of the lungs getting filled up with air, the pleural space is getting filled up with air. So that's why the air is pushing the outside of the lungs and makes it collapse, because the air is escaping from the lungs and it's pushing the lungs towards the side of the side that isn't collapsed or affected by pneumothorax. And it is also classified as a restrictive disorder. So some types of pneumothorax, we have a closed one, means that the air or the atmospheric gas is not in direct contact with the gas that's inside our lungs. And then open pneumothorax is basically having an open side that is having a direct contact from the atmospheric gas and the inside or intrapleural gas. And then we have a tension pneumothorax, which is a pressure that is exceeding in the intraalveolar pressure. And then we have three other pneumothorax that is identified as traumatic, spontaneous, and iatrogenic. So we're explaining those three on the next slide. So traumatic pneumothorax. This kind of pneumothorax is basically having a stab wound or a gunshot, or when you are involved in a motor vehicle accident. This could happen because this is basically creating a puncture from the outside of your lungs going inside your lungs and creating that open pneumothorax. So basically in the traumatic pneumothorax, the gas from the atmospheric and the intrapleural or inside gas is basically meeting together or is in direct contact. And as it says on the bottom, it is considered as an open pneumothorax. And next we have spontaneous pneumothorax. So we have a lot of things listed in here, but what I would want you to get from spontaneous pneumothorax is it basically happens without any sort of reason, or we don't know where it came from. Of course, there's going to be a reason why pneumothorax happened, but we don't know the actual cause of this kind of pneumothorax, so we call it spontaneous. So we're basically trying to figure out what happened into it, but if we don't have a indefinite reason or cause for it, then we just call it spontaneous pneumothorax. Excuse me. So next we have iatrogenic pneumothorax. So I have a lot of things listed on the PowerPoint. You guys could just read it. Iatrogenic is basically what us or the healthcare providers did. So basically, we do this kind of pneumothorax, or we actually created this for the patient. So some of the reasons on how to obtain an iatrogenic pneumothorax is pleural or liver biopsy, thoracentesis, tracheostomy, and having a lot of pressure being put on the patient via a ventilator. So it is common with COPD patients, HIV, and related ARDS because COPD and ARDS, when they're having exacerbation, if it's like in a severe state, we put them on a ventilator. So if that happens, sometimes we can, sometimes we put too much pressure in it that we are not aware that we're creating a pneumothorax. And then some of the anatomic alterations of the lungs, as I said earlier, we could have a lung collapse because we are creating a puncture, or there's a puncture or a lesion inside the lungs and the air is escaping from it. Atelectasis because we have a puncture or hole from the lungs, so there's not much air going inside the actual lungs. It's rather going in outside or in the pleural space. Chest wall expansion because the air is outside the lungs, so it's in the pleural space. So our ribs will be more hyperinflated and our chest will be more hyperinflated or much expanded than our normal. And compression of the great veins and decreased cardiac venous return. Compressions of the great veins because our lung unit is being collapsed, or anywhere on our lobes. Like for example, our upper left lobe is collapsed. So the great veins in there is being collapsed or being pressed down because our lungs is trying to shrivel. So it's basically compressing it. So it decreases the cardiac venous return because, as I said earlier, it's like, squishing those veins, so there's not much blood circulating in there. And then consolidation, because as I said earlier, we have atelectasis, so there's more opacities in there. Excuse me. Some causes and symptoms. So symptoms, it's kind of very vague because a lot of the lung diseases could have a sudden or severe sharp chest pain and shortness of breath. But this is basically the two major symptoms that the patients are showing. And patients could also show some cyanosis or in distress or anxiety at this point. And the causes are chest injury, as I said earlier, from a motor vehicle accident. So we could create a lot of like injuries in the chest area by moving from the accident. And lung diseases, so such as COPD, as I said earlier, ARDS, because they are more prone to hyperinflation or restricting the lung area. So also ruptured air blisters or creating blebs or bullae, so such as subcutaneous emphysema or emphysema. These are they are prone to having pneumothorax because they already have that rupture in the lung unit or the lungs itself. So air could pass through in and out. So they are more prone to having pneumothorax, subcutaneous emphysema or emphysema patients. And as I said earlier, mechanical ventilation because of too much pressure being put in. Some risk factors, so gender, older people tends to have a lot of these. So we're gonna cover this risk factors in our next video. Thank you guys.